This month, we're expecting millions of people to hit the skies for holiday travel, but the long flights can really impact your health. And that's why today we have Dr. Anita Skake here from the Allina Health Heart Institute to make sure we're feeling good for those holiday celebrations. Thanks for being here.
Well, thank you so much, Cece, for having me, and happy holidays to everybody, and wish everybody safe travels.
Absolutely. I mean,
Yes.
so many people are catching flights, and they can really wreak havoc on our bodies sometimes, those flights. What are the impacts?
Yeah, of course. You know, air travel can affect the heart health, especially the cabin can be pressurized to almost equivalent to a level of 6,000 to 8,000 feet above sea level, as if you're in an Estes Park kind of in Colorado. So the oxygen supply would be a little bit reduced. So if you have problem with breathing, this is going to be kind of a little bit difficult to breathe. On plane, also the air that's pushed on the plane is actually very dry. That can lead to kind of itchy eyes, you know, painful sinuses and ears. And both situations, the pressurized air and the dry air, can exacerbate really kind of medical problems that require supplemental oxygen. Patients with heart disease, lung disease might feel a little bit kind of difficult breathing in the flight. And also sitting confined in the plane, especially plane rides or even car rides more than 4 hours, would lead to increased risk of deep vein clots. So it's very important to kind of think about those risks when you travel.
Absolutely, especially during those really long flights or if you're going international.
Exactly.
So who's most at risk for these symptoms or these impacts, and how do they kind of help to prevent them a little bit?
Yeah, that's very important question. I think first and the most important thing is to discuss with your primary care physician or your cardiologist your risk and your specific risk for traveling. But basically, based on the things we discussed already, patients with lung disease, heart disease, or even patients with history of blood clots should be careful about traveling and should discuss those risks with the primary care physician.
Absolutely. Okay,
Yeah.
take note of that for sure.
Yes.
Not only those impacts, but I was just on a flight and I saw a lot of people with masks on. There's viruses going around.
Yes.
How do we protect ourselves from that too?
I think it's very important to kind of think about traveling. If you are already sick or have viral infection, I would recommend that you stay home, not to travel, but if you really must travel, I would strongly recommend that you wear a mask. Or even if you're not sick, but you're at increased risk of getting an infection, it's very important also to consider wearing a mask. Stay hydrated, really, you know, during these flights, and get up and walk around as well, too, and avoid too much caffeine or alcohol drinks. So, and also sometimes we recommend vaccination, especially flu vaccine. If you're high risk, if you have history of heart disease or lung disease, it's very important to kind of get your recommended vaccine. So.
Absolutely.
Yeah.
Great tips, doctor. I know I really liked when I saw folks wearing those masks who were sick. Well, thank you so much again.
Oh,
ahead
it's
of
my
the busy
pleasure. Thanks for
holiday.
having me. Happy holidays, everybody.
Yeah, and of course,
Thank
we'll
you.
have more of these tips at care11.com/noon. We'll be right back.